My name is Jaleen Johnson. I'm the program manager of the Northwest Regional Telehealth Resource Center. As Wendy was saying, I'm also now a certified digital equity professional. What that means is yet to be determined, but it is something that I've been really deep in for the last year as I've gone through this journey of a digital inclusion fellowship and kind of taken a really deep dive into some of these initiatives. To get started, just wanted to put out the disclaimer that we have no relevant financial interests. Everything today is purely informational, so forth and so on. Okay, so the Telehealth Resource Centers, or TRCs, are funded by the Office for the Advancement of Telehealth, also known as OAT, and the Health Resources and Services Administration. There is actually 14 of us across the nation. There are 12 regional and 2 national. As you can see from the map on this slide, that kind of outlines the different regions that were broken up into. There's a Telehealth Resource Center for every region in the United States, which is great because, as you guys are aware, not every region has the same challenges and opportunities. We also have the 2 national telehealth resource centers. Those are the Center for Connected Health Policy, or CCHP, and also TTAC, or the Telehealth Technology Assessment Center. CCHP is a great resource for everything policy, reimbursement, you name it. They have a great website where they've broken down all of the telehealth policies on the federal and the state level. They're frequently coming up with circuits and information on all of the updates, so I would highly suggest connecting with them as a resource for policy, as that is the #1 question that we get as a telehealth resource center. And then there's also the Telehealth Technology Assessment Center, or TTAC, and what they do is take agnostic dives into telehealth technology so that you don't have to. And they serve kind of as the telehealth resource center for technology. If you're looking to stand up a telehealth program in your practice and you want to know more about what technology might be best for you, reaching out to them is a great option. So now just to tell you a little bit about us in the Northwest. So we cover those states from Alaska all the way down through Utah. There's 7 states in our region, including Alaska, Idaho, Montana, Oregon, Utah, Washington, and Wyoming. And our main purpose, again, is to kind of just serve in technical assistance, provide educational resources, do a little bit of consulting for those who are looking to implement cost-effective telehealth programs into their practice. We have a few of our highlighted resources listed here. At the top corner is our telehealth training catalog, which is a great resource for providers looking to get a little more telehealth training. A lot of those courses do offer CME, and they are free and open to the public. You can enroll in them at any time. You can complete them at your own pace, whatever you would like to do. And a lot of them are put together through partnerships that we have throughout the region. There's also this end of the PHE compliance checklist that we released last May. With the end of the public health emergency, there was a lot of questions about what waivers would be in place, what was going to change back, what was going to stay. So we put together this checklist for everybody to kind of take a look at, just to ensure and assess their program was compliant for the future. We also have the NRTRC Find Telehealth Map, which is a great resource. It is a mapping of facilities providing not just telehealth, but in-person care and both throughout the Northwest. We actually recently partnered with the Southwest TRC to add the states of Nevada and Arizona to the facility mapping, but it also contains a mapping of telehealth access points. If you saw my earlier presentation, we talked a lot about telehealth access points, so I won't get into the details of that, but those are the basic open spaces that we're seeing at community anchor institutions and places like libraries, community health clinics, housing authorities, different things like that, where you could go and have a telehealth appointment. We put those on the map actually for the entire nation, so while the facility facility mapping stays within those states. You can map a telehealth access point anywhere across the region on this map, and it's a great resource. We also have the Critical Access Hospital Telehealth Guide, which is meant for critical access hospitals, but really is a great starting point for any facility looking to implement telehealth. There's great codes and services table on in that resource that a lot of people find really useful. You find all this more at our website. But without further ado, I'm going to go ahead and pass over to Jaleen to introduce herself. Thank you.
Thank you, Jaleen. So this is such a cool opportunity because we get to go up from the national and Northwest regional level back down into a local level. So as stated, I'm Jenny Rojanasthien. I'm the Executive Director of NCW Tech Alliance. And our goal under NCW Tech Help is to pave a way for a more connected tomorrow, where everyone has access to digital skills, devices, and the internet. But a little bit about the nonprofit behind NCW Tech Help is NCW Tech Alliance. We are a 501c3 passionate about connecting people and technology resources together. We've been around since 1999 with the vision of supporting work in technology, entrepreneurship, and STEM education. And we deliver value back to our community by offering educational events, programs, resources. We believe that everyone should have the full potential to live where they love without sacrificing any of the affordabilities of being in a bigger city. We're here to ensure that rural communities are not left behind as technology continues to accelerate. And so we are really passionate and proud of the work that we're doing behind NCW Tech Help. A little bit about our regional ecosystem here in Washington State. So we have local, regional, and out-of-state guests here today. We represent 4 counties of North Central Washington in this work, as well as the Coalfield Confederated Tribes, to work together on the digital divide. To add some context about how our ecosystem is connected together, let me first start with the broadband action teams. Broadband action teams are community-driven collaborations that identify connectivity and accessibility needs for our communities. And until this year, the only broadband action team in North Central Washington was Okanagan County. They really came to the table early on and have been a leader in this space, having started their work in 2019. In fact, if you weren't in the breakout session with Ronnie Holder Diefenbach and Kayla Wells-Yoakum earlier, they shared how their broadband action team was successful in receiving $30.1 million that was just announced this past month to expand rural internet service across Okanagan County. So the broadband action teams can be really powerful partners in bringing additional funding out to the region. Okanagan County first on the scene. Now this past 12 months, the Washington State Department of Commerce and through partnership with Washington State University supported the development of additional broadband action teams across the state. Chelan County decided to form a full broadband action team, which means they have both an infrastructure and a digital equity plan, whereas Douglas and Grant County, who are completing their fiber build-outs, just opted to play in the digital equity space. As our region represents a huge geographic footprint from Washington State with some of the highest needs for our community members, another divide that we often fill is the Cascade Curtain divide, the mountainous divide between us and the west side of part of the state where they obviously have a higher population center. So it's really important for us regionally to bring strength in numbers across rural partners who are often collaborating to support community members across this wide geographic range. And it's also important to be conscious of capacity because as we are less populated and our nonprofits and our resources are often stretched, we're trying to build power in numbers to make the workload easier across. We have our first public-facing call for the Digital Access and Equity Coalition coming up on September 28th. Those are all open to the public, and I invite you to join. Our coalition goals, by bringing everyone together, are simple, but the work is vast and ever-changing. We want to increase access for covered and underserved populations. We want to increase visibility for digital equity work. We want to engage in knowledge sharing and collaboration. And of course, we want to bring more funding opportunities across our region. There are dozens of organizations that are involved in this work, which The most of it has really developed over the last 12 months, but I just want to highlight our steering committee on this logo soup up here today, many of whom were in the room and have really supported our work. Now back to Jaleen.
Okay, so the main objective today involves discussing why digital literacy, why broadband equity and inclusion, and our digital inclusion really matter to healthcare and what resources are available. I think it's important to note that it's especially crucial for us as a telehealth resource center because of a survey that we did. We do an annual telehealth survey, and in the years for 2021 and 2022, it was actually noted that 35% of our respondents said that patient access barriers were their top need in terms of technical assistance for telehealth. And I mean, there are reasons that are more obvious than others. You can't have telehealth without a proper broadband connection, but after identifying this in the survey for the whole region, we knew that for the foreseeable future, this was going to have to be a really big goal of ours, and closing those gaps and creating more tools for patient digital health literacy is going to be especially important. I think it's also important to just sit back and define what digital inclusion and equity actually are. I think a lot of people in this room probably have the idea or already know about this, but being that I just got done with a fellowship, I'm going to put the definitions out there anyway. The National Digital Inclusion Alliance, or the NDIA, I'm going to talk about them a lot as an organization, defines digital inclusion as the activities necessary to ensure that all individuals and community have access to and use of information and communication technologies. And digital equity is a condition in which all individuals and communities have the information technology capacity needed for full participation in our society, democracy, and economy. Both of these are necessary for civic and cultural participation, employment, lifelong learning, and access to essential services, and that includes healthcare. On the healthcare side, digital literacies and broadband connectivity have long been called the super social determinants of health because they address all other social determinants of health. According to a journal from NPJ Digital Medicine, it was discussed that applications for employment, housing, and other assistance programs, each of which influences an individual's health, are increasingly and sometimes exclusively only available online. Access to information on healthcare providers and their services are increasingly being digitized by things like patient portals, and that makes it nearly next to impossible to manage your own health without the knowledge of how to use a device or proper broadband access. All of this is pointing to the fact that the cost of equipping a person to utilize the internet are far less than treating a health condition once that becomes an issue. And so we're highly encouraging this for a reason. So now let's get into the state of digital equity and inclusion as we look at the nation as a whole. As practitioners of digital equity and inclusion, there is something that we call the digital opportunity skills gap as it pertains to unemployed adults. In the United States, there's about 9 million unemployed individuals, of which at least 3.2 million lack foundational digital skills. This lack of foundational skills prevents these individuals from competing for an estimated 75% of available jobs. And it should also be noted that the level of federal dislocated worker funding that's available to the United States in FY22 only supported about 2% of those people. Even though we're talking about digital skills as they pertain to employment here, the concepts are completely transferable to all aspects of life that require digital skills, including managing our own health. Plus, I mean, most people get their healthcare through their employment, so it's entirely applicable. For the state of Washington, let's talk about how everybody measures up on the scale. So this scale was put together by the NDIA. It measures each state based on the amount of the broadband access that's available in that state, the amount of programs there are for building digital skills, different things like that. You guys might be pleased to know that the state of Washington on this scale actually measures at a 6 out of 6. That is the most points that you can get according to the NDIA in terms of where you guys are at in terms for digital equity and addressing those skills gap. So that's pretty amazing. I mean, you guys are the cream of the crop, and there's really nothing else to teach here, so I'm going to go ahead and end the presentation now because you guys solved it. Congratulations. But not entirely. I think that what's coming next is Jenny's going to talk a little bit about the unique challenges that this specific area has. I think as compared to the rest of the state, you'll be interested to know, and you guys probably already are aware that the challenges here are very unique compared to the rest of the state. And also, digital equity and inclusion are kind of having this really, really cool pivotal moment. And so I think moving forward, we're going to have a few resources and tools that are available to you all if you want to get involved a little bit more in this space and learn about what's happening in the state of Washington and across the nation.
I wish we were done, right? 6 out of 6. We just go home, go back to a social. But as Jaleen said, right, the work is very real, and we have a lot of progress to do here in North Central Washington. So let's dive into our regional stats here. Sorry if that's a little hard to read on screen. When we're talking about households without a desktop or laptop, 1/4 of our communities in Chelan and Douglas County do not have a laptop or desktop in the home. That's nearly 1/3 of the population in Grant County and Okanagan County, compared to 15% statewide. So again, when we're talking about that cascade curtain and what's happening out in Eastern and North Central Washington, we want to mobilize to help change these numbers. In terms of internet service, those numbers get a little better. The state is looking at 12% without internet service. But as you can see here, Chelan, Douglas, Grant, Okanagan, all at the 17 to 20% range for internet. And that's, not even diving into the affordability, right? So there's other factors that go into digital equity and the digital divide. We're not going to be able to get into all of those today, but we recognize that there are some pretty unique challenges and needs in our region. When we look at our 4 counties, we have the lowest average household income in the state of Washington and the lowest educational attainment. We have 2 really outstanding community colleges, but we have no 4-year universities in the 4-county region. So the distance and lack of public transportation can make even those community college opportunities very inaccessible for many of our residents. We recognize that we have a high Latinx or Hispanic population, over 30% of our residents, and that can increase to 70% depending on which pocket of the community you're looking at. And we know that there's a tremendous disparity in our educational attainment when we consider the intersection of race in our communities. So what does the stats look like in your community? We're going to do another hands-on activity with the group here. This is using Microsoft Sila Power BI resource. I'm going to leave that on screen for just a minute, and then I'm going to pull it up and we're going to look at it. This is a great resource across all of the United States to dive into digital equity. Okay, again, it's going to be too small to read, but now I've brought down just to Chelan County, so I can really dive into the data here, which includes things like 25 years and older who have not graduated high school. Again, households without a desktop or laptop, without internet subscription of every kind. What is the percentage of their median income spent on broadband? Because we know affordability is an issue. So it's 2:28. I think this is on Jaleen's time, so this is 1:28. We're going to spend 5 minutes. I want you to talk about this at your table, about what are the stats that you're seeing on any county that you pulled up, local, from your hometown. Is anything surprising you? What are you reading? What are you learning? So we're going to do 5 minutes.